My name is Isnardi, and I'm one of the authors of the study Immune Response to SARS-CoV-2 third vaccines in patients with rheumatoid arthritis who had no seroconversion after primary two-dose regimen with inactivated or vector-based vaccines, published in December 2022 in the Journal of Rheumatology. The aim of our study was to assess the immune response after a third dose of SARS-CoV-2 vaccine in patients with rheumatoid arthritis with undetectable antibody titers after the primary regimen of two doses. Patients older than 18 years old with rheumatoid arthritis from two rheumatology centers from Argentina who had no seroconversion after two doses of SARS-CoV-2 vaccine and received a third dose of either mRNA or vector-based vaccine were included. Patients' blood samples were taken between 21 and 40 days after the third dose. Anti-SARS-CoV-2 IgG antibodies, neutralizing activity, and T-cell responses were assessed. A total of 21 non-respondent patients were included. All of them were women. At vaccination time, 28% were receiving glucocorticoids, 85% biologic DMARDs, including 6 abatacept and 4 rituximab. Regarding the primary vaccination regimen, 62% received 2 doses of BIVCOV vaccine, 14% GAM-COVID-Vac, and 14% ChAdOx-nCoV-19, and 9.5% a mixed regimen of GAM-CoV vaccine and mRNA 1273. At the third dose, the majority received BNT162b2 vaccine and only one of them ChAdOx1 and nCoV-19, all of them mixed regimen, with a median time between the second and third dose of 180 days. After the third dose, 90.5% of the patients presented detectable anti-SARS-CoV-2 IgG. The frequency of antibodies development was comparable between groups, but as you can see, it was slightly lower in those receiving rituximab. 76.2% developed neutralizing activity compared to other treatment. Abatacept and rituximab were associated with the absence of neutralizing activity and lower titers of neutralizing antibodies. Specific T-cell response was detected in 71.4% after the third dose. The use of abatacept was associated with lower frequency of T-cell response. Finally, I want to thank to all the groups that collaborated in carrying out our study. Thank you for your interest in our study, and we invite you to read the entire paper in the Journal of Rheumatology website.